Hi, this is Dr. Rozakis. I was asked to put together a replay of the recent webinar, and here it is. So we're going to talk about age-related macular degeneration, and we want to know how to stabilize and recover vision and reduce the need for injections. And all of those are successes. If we can stabilize it, that's a success. Recover and reduce the need for injections. So I'm Dr. Rozakis. I'm a biomedical engineer. I'm an ophthalmologist. I've been in practice for 35 years. I'm also one of the pioneers of LASIK eye surgery. But over the past 15 years, I've been very active in the field of cellular medicine, or sometimes we call it advanced wellness. I've been working with a PhD, Dr. Brian Bakke. We've been working together for 10 years now. His PhD is in biochemistry, and he also has a master's degree from Columbia Medical School, where he matriculated his master's on macular degeneration. Together, we have done a great deal over the past 10 years, including winning an award, which you see on the left. It was the Crane's Advancements in Healthcare Award. So what we want to do today is teach you what causes macular degeneration at the cellular level so we can prevent, stabilize, and reverse the condition. Unfortunately, the current standard of care is to simply monitor the disease. That is all that you all are experiencing. You go to your eye doctors every 6 months or so, and you're checked and told how good or bad it is. And that's the way it is. So maybe you look like this, where you have little tiny spots in the back of the eye, which I can point out to you right here. Those are called drusen. If they progress, they look like this, where vision starts to decline, and sometimes they coalesce and form large areas of atrophy and loss of function leading to blind spots. And this is what we want to avoid. But all we're doing right now for this condition is basically just observing it progress. In some patients, the disease can also become wet, where blood vessels start to grow and leak, causing hemorrhaging, which is what you see here. This is the problem that we need to address. The current approach to addressing it doesn't do a whole lot. The ARADS formulation does not prevent the disease, does not prevent the eyes from going wet, does not improve vision. It has some value, but not as much as people think. What most doctors basically do is just watch dry disease progress to wet. So really, eye doctors, including myself for many years, we've been spectators, just watching the condition, telling patients not to smoke, eat green leafy vegetables, and call me if it gets worse. That's code for call me in case you start to need injections into the eye. This standard of care is ancient. It's almost 20 years old, and 20 years is a long time in the world of science. And if you compare with the world of computing, you can see on the right a cover of a magazine. And look at what those computers looked like 20 years ago. They were basically ancient. And we've done so little to advance the field for macular degeneration, and it's unfortunate because a lot of science exists to show that we can do something more. So we did that. That's what we did. That's why you're here. Our first clue that we could benefit macular degeneration was actually my mother. My mother had pretty significant dry macular degeneration. It certainly worried me when I looked at it. Her sister also had pretty advanced disease as well. But we put my mother on a cellular medicine program to help her with her aging because these programs are basically designed to take care of the problems that occur in the body with aging. And in her case, I noticed that she just would not lose vision. For 15 years, she stayed stable, which was pretty remarkable. Then we had other patients who could see faster and better when they went into a dark room, like a movie theater. That was really interesting. Why did that happen? We had ideas on that, but we noted it. And then we had a patient back in 2013 who actually said, "Hey, I can see better." And we were so impressed by how much better she could see using our strategies to fix the biochemistry inside the body and the eye that we put out this press release trying to tell people, hey, look, there's more we can do to improve vision using hormones, genetics, methylation, all the things we're going to talk about later. So this was quite interesting to me. I said, wow, what we're doing can actually benefit the macula. Then this patient came along. This is a watershed case. She had wet macular degeneration shown by this mound over here. And she was getting injected every month, and she had been injected about 9 months and was not responding to these injections. Now, what are these injections? Well, they're designed to remove growth factors from the eye, shown by this little demon here. There are growth factors which stimulate the blood vessels in the back of the eye to grow, and we want to get rid of these growth factors with the injections. And even though this person was getting injected, they weren't working. She was not responding. So we optimized her biochemistry, and lo and behold, over 6 months, that mound just disappeared completely. And her retina doctor stopped injecting her. And that was incredible. That was amazing. And I'll tell you how that happened a little later. She appeared on the nightly news and on WKYC because she really was a landmark case. So, based upon these observations of the patient who no longer needed injections, and my mom's stability, and the person who could see better, and the person who can see better at night, we decided that it was time for us to focus on macular degeneration. And in 2020, we identified 365 eyes of people with dry or wet macular degeneration, and we optimized their biochemistry and noted the outcomes. We published our work in a peer-reviewed journal, and we're happy to report that not only could we stabilize vision, but we could also improve it. 48% of dry patients noted that they could see better than before, and 60% of wet patients noted that they needed fewer injections and could also see better. And those are pretty big numbers because we're talking about improvement. Not only improvement, what does improvement mean? It means reversibility. We're stabilizing, we're reversing. People with dark spots in their eyes were showing improvement as well. This is really exciting information that we can finally make it a goal to try to improve vision. And for people who are getting injected, the fact that 60% of them needed fewer injections was really exciting, to say the least. So we have a new strategy now to benefit the wet patients. Now, why did they benefit? Well, it turns out that we were also lowering those growth factors in the eye with these strategies to improve biochemistry, which is really cool. So how do you put this all together? And this is, I'll explain it. Because we're seeing improvement, because 50% of eyes improved, the data is telling us that we must treat before irreversible damage occurs, right? Because 50% improved, 50% stayed stable. Well, if we had caught those people earlier in the process, we could have stabilized them earlier in the process and minimized the amount of irreversible vision loss. So, and in 50%, we can get improvement. So this is telling us that we need to act more definitively when somebody has macular degeneration. We want to stabilize it and try to get back any vision that may have been lost because reversibility is now possible. So getting checked every 6 months to monitor the progression of macular degeneration is no longer good enough. Basically, I'm telling my colleagues it's time for us to stop being spectators of this disease and actually intervene and go after the causes of it by optimizing the biochemistry inside the eye and the cells. Another way to draw a conclusion is to say macular degeneration is now a race against irreversible structural damage. Time is a variable because up until now, people have just been observing it progress and observing it progress. Well, we're saying, hey, wait a minute, we can stop it and try to reverse it. So that's cool. So we're trying to fight against irreversible, what I call structural damage. What does that mean? Well, this is a perfectly normal retina that you're looking at here. There are billions of cells in here. They're all doing their job, so this person is seeing. But if we don't take care of the biochemistry inside these cells, then we're going to lose structure. The retina will start to look like this. It'll be deranged and abnormal, and vision will suffer. So if we don't act to protect the cells by optimizing their biochemistry, we lose structure and we lose vision. So the new mantra is catch it as soon as you can. Catch this disease as soon as you can, and if somebody has it, start identifying what's wrong with their biochemistry and fix it. So here's a patient who doesn't have any macular degeneration based on looking at the macula here, but this technology shows that this person may in fact develop the disease. So if we know that and we treat at this point when the patient's still 20/20, and we can avoid vision loss, avoid injections. We can do so much good. If we can catch it in this stage where it's pretty early stage, that'd be great because this person can still see, pretty well. If they've lost some vision, we have a 50-50 chance of getting back some vision. If they're at this stage, it's, we at least want to stabilize it, but hopefully we can get back some vision. This person might be 20/70. Maybe we can push them back to 20/50. But if they get to this stage, it's hard to say that we can help them. This might be irreversible damage that is beyond repair. And with regard to wet disease, it would be wonderful if we could avoid wet disease altogether, not let it happen, because by putting people on these strategies to fix their biochemistry, we can lower the growth factors in the eye and hopefully avoid the need for injections. But if you're getting injected, we can add a second strategy to lower the growth factors in the eye to benefit wet macular degeneration, which is a real serious problem. You don't want to get wet macular degeneration. That really is not fun. So I have this slide here. It says, "Are we surprised?" Because we've been working in the world of cellular medicine and biochemistry now for 10 to 15 years. And before we got involved with the macula, we were doing a lot of work in patients who had other illnesses, severe illnesses, depression, anxiety, fibromyalgia, migraine, cardiovascular disease. I mean, so many different conditions. And back in 2015, we won the Advancements in Healthcare Award for the science that I just presented to you that benefited the macula. So are we surprised? Not really. It's pretty cool science. If it wasn't so cool and effective, we would not be wasting our time with it. So we're not surprised, but we're happy, to say the least, that it worked. So the eye is now really a fascinating place where we can actually detect situations where people's biochemistry is not working correctly. So what I'm going to do now is tell you more about how we do it or did it. We call our method the homing method, HOMING. So I'm going to take you into a deeper dive into science. Many people like the work or the presentation they've heard to this point, so hopefully you did too. But now I'm going to take you on a deeper dive into the science so that you get a better gestalt or feeling about it. So homing stands for hormones, oxidative stress, methylation, inflammation, nutrition, and genetics. We need to reverse hormonal deficiencies because that can cause cells to not function correctly. We need to reduce oxidative stress, another common problem with aging, because that can cause cell damage and that can accelerate the aging process, including macular degeneration. We can reverse something called methylation disturbances, which are very much tied into the aging process as well as tied into macular degeneration. Same with inflammation. Nutrition is very important. And some people have genetic errors, which if they're there, there's strategies we can use to compensate for them. The trick to this is to do all of these simultaneously. You can't just use nutrition, although nutrition is important. You can't just do hormones. You can't just do oxidative stress. If you want to get the best outcome, you need to pull these all together and do them simultaneously. So as I like to teach, this is not one thing medicine, because lots of people say, what should I do? What one thing should I do? And that's what they're asking. The answer is that's not enough. It's a complicated disease. We need to do all that we can to get the result to make those cells in the back of the eye healthy, because ultimately the problem is healed by cells. And I can tell you this, when we wrote our paper and put in the 108 references, every one of these letters alone has value for the macula. I can show you literature on hormones and oxidative stress and methylation. Every one of these alone has value, but the key is to do them all simultaneously. And that's where you can start pushing those cells and supercharging them and getting some vision back. That's how that 50% number came to be. So right now, everyone is out there taking the ARADS vitamins, which is really just tapping away at macular degeneration with one little finger. If you want to really knock out macular degeneration, you got to bring all of these capabilities to bear. It's like making a fist and just, knocking out the condition. That's got to be done simultaneously. That's the whole key. I need you to get that. These disturbances that we find, these hormonal imbalances, oxidative stress, methylation issues, etc., are like small little biochemistry fires inside the cell that can ultimately lead to blindness. So this is a house showing it's burning down, but there was a point where these fires were little tiny fires in the basement of the house that no one could even detect, and they were let to grow and grow and grow until finally you have this situation. you want to avoid this. You want to put out the little fires inside your cells and your body by finding what's wrong and fixing it. Because if you don't, you get structural damage. These are spots called drusen that you may have heard of. Here's normal over here. Here are the drusen over here. We need to, fix the biochemistry because that's what precedes the beginnings of these spots and other abnormalities. And again, if we don't improve the biochemistry, we lose structure. So here's normal, here's abnormal. One of the key principles behind what we do is the concept of epigenetics. Epigenetics has to do with what genes are turned on or turned off. It's really, really important. Back in 2006, this was published I'll read it. It says today a wide variety of illnesses, behaviors, and other health indicators already have some level of evidence linking them with epigenetic mechanisms. In other words, the wrong cells are turned on, and the wrong genes are turned on, and the wrong genes are turned off. And that causes havoc in the biochemistry of the cell. So we need to make the biochemistry healthy by making the genes properly turn on and turn off. Because if you don't, then these epigenetic errors and mistakes can lead to cancers of any type, mental issues, breathing, heart, reproductive, autoimmune, or behavioral. That's in 2006. Today, there's 100,000 articles that talks about epigenetics. It's really important. And it's epigenetics that turns off the gene that makes that growth factor. Remember, I told you earlier that these programs to fix the biochemistry can lower the growth factors in the eye. How does it do that? Well, it turns off the gene that makes the growth factor. Boy, oh boy, was that exciting to learn that and figure out how that person got better. And that explains why we have a 60% improvement in wet macular patients. It's pretty cool. So just to show you that literature exists, okay, here's a paper on epigenetics tied into macular degeneration. Hormones are very much involved in activating good genes, so they also work at an epigenetic level. You want to turn on your good genes. If your hormones decline, which is common with the aging process, then your biochemistry won't work like it's supposed to, and you'll start to have many symptoms and problems. Back in 2008, I asked the question, hey, does the macula need hormones? That's a fair question, isn't it? And I wrote about it in Life Extension magazine because I had this real strong belief that these drusen, these little tiny spots in the back of the eye, were related to low hormone. And it turned out that I was right, that more literature came out showing a strong connection between hormones and the macula. The macula needs hormones. And it's true to say that hormonal levels, when they decline, can negatively impact the macula. So here's a paper talking about hormone therapy as a protective factor for age-related macular degeneration. Here's another paper that was published, great paper, back in 2007. See, the literature is already there. This is one of my frustrations with this field is that the literature exists, but no one's acting on it. It took until us coming along to pull this all together and act on it and do the studies to get outcomes. So that's what we did. And so here's another hormone called DHEA. And if that level is low, you get more macular degeneration. And we see low levels of DHEA all the time. You probably have it as well if you have macular problems. Well, that's the H. Now let's go to the O. Oxidative stress causes damage to cells, but your cells have the ability to fight off oxidative stress. We just have to turn on the genes that allow them to fight oxidative stress. So that's another strategy. That's the O strategy. And there's certain things we can do to make that possible. Methylation is a really important area. It's really critical to this whole epigenetic concept, this idea of turning on genes and turning off genes. It's methylation that turned off the VEGF gene. And there's literature connecting it to macular degeneration, cataract, diabetic retinopathy, cancer, heart disease. There's just so much value that back in 2013 we put out this release trying to get the attention of the world to the importance of methylation. And so that's the M in the word homing. Here's a paper talking about methylation and how it connects to macular degeneration. Inflammation is really, really important. If your body is inflamed, it's going to cause cellular damage, and your cells have the ability to fight off inflammation. We just have to turn on the genes that help them do that. There's a substance called C-reactive protein. It's very much tied into the pathogenesis of macular degeneration, and obviously this is something we look at and work on improving. Nutrition matters a lot. It's connected to oxidative stress and inflammation. It's really important. So nutrition is in the word homing. And finally, genetic errors. And here I like to give the example of MTHFR. It's a genetic error that if you have it, it's going to increase your risk of many diseases, including macular degeneration. And it's so easy to work around that problem by just giving the cells in the body, what the genes are not making for them. So there's so many easy, straightforward strategies that we can employ to help the macula and help the cells. And again, we have to do all of these simultaneously. It's like having a car with 4 flat tires. You can't get back on the highway until you treat all 4 flat tires, right? And what are we doing? We're trying to fix the biochemistry inside the cells. That includes the photoreceptor cells, which are what do the seeing, and the retinal pigment epithelial cells, which are really critical. This is where a lot of the action occurs with regard to macular degeneration. These are critical cells and they're struggling. They have hormonal deficiencies. There's oxidative stress back there, methylation pathway problems, inflammation, nutrition, you're not eating correctly, genetic errors, et cetera, et cetera. So we have to fix this area. Otherwise, these blood vessels will start to grow up and in to the macula and cause serious problems. So as we said, it's really important to catch this condition early, treat these homing disturbances, comply with the program, and by going after the causes of macular degeneration, you can stabilize it and even get back some vision. You can recover some vision. Now, this type of care of looking at homing abnormalities doesn't just help the cells in the back of the eye. It helps basically all the cells in the body, whether they are cells related to diabetes, other retinal cells, other eye conditions, immune cells, bone cells, brain cells, basically all cells are suffering from the disturbances of hormones, oxidative stress, methylation, inflammation, nutrition, and genetics, the homing paradigm. So it's important to use this type of care as a strategy for general overall health and well-being. It is no surprise at all that people think better, do better, feel better when their homing abnormalities are resolved. We hear it all the time. I have more energy. I'm sleeping better. My cholesterol levels are better. People are healthier because health really is optimizing biochemistry. So if you're back in the Stone Age of using the ARADS formulation, which is 20 years old, it doesn't prevent the disease, does not prevent the eyes from going wet, does not improve vision, then I have exciting news for you. We can bring you into the state-of-the-art new age of you taking advantage of all the great science behind the homing method. And that's what this paper represents. And it's all about fixing biochemistry. So I would strongly encourage anybody with dry macular degeneration to take advantage of what we have done for everyone. We've gone through the literature, we've figured it out, and then we did this study to prove it out. This is I think this is a new option to avoid wet disease altogether. Think about it. If you have dry macular degeneration, the last thing you want is for it to convert to wet. But if we can put you on a plan to optimize your biochemistry and lower your growth factors in your eyes, then the motivation to become wet should be less. So I'm hoping that we can actually help avoid wet AMD if you have dry disease. Now, if you already have wet disease, okay, you're getting injected every month or 2 or maybe 3, and that's no fun, obviously. So if we can add to the injections, this strategy of taking care of your homing abnormalities, then we can help lower VEGF, the growth factors, every day you're on the program, as your retina doctor injects you every month or 2. And this combination, remember, got a 60% improvement over injections alone. So in macular degeneration, we must use homing to treat functional disease, in other words, biochemical disease, as soon as possible. It's a time game now, before structural damage changes become irreversible. So here's a perfectly normal macula over here, shown again. If we don't take care of the biochemical disturbances that are going on in here, uh, then um, then we're going to start to lose structure. And this is where it becomes irreversible when you have structural damage. You want to keep this structure as good as you can, make it function better, and that's possible using the homing method. That's what we're concluding. So it's time to knock out the disease, go after it more aggressively. So a big uh, thanks to my mom who triggered all of this, because if it wasn't for her staying stable, I might never have gotten focused on this area. But she got better, the other people got better, and that's what prompted myself and Dr. Baki, the PhD, to do that study in 2020 so that we can do more for people with macular degeneration. We don't want you to go blind, and we want eye doctors across the country to stop being spectators of the progression of the condition. That there's no value there. I mean, anybody can watch a disease progress, but what you want is you want to know the causes of the condition and then have a strategy to go after those causes. And that's what we did. We found the homing causes. We treat the homing causes. The eyes responded, and that's a big deal. So we're excited. I hope that this is something that you take advantage of. But remember, catch it early. Catch it as early as you can. Catch it before you go wet. Catch it before you lose vision. It's a progressive disease. Don't let it ruin your life. It's no fun to have macular degeneration.